Right, good afternoon, everyone. Um, Thanks for taking the time out of your busy schedule on this weekend. We're back again for another SG Psych Staff Talk, this time in conjunction or in collaboration rather with Mindline.sg and in conjunction with World Mental Health Day, which was actually yesterday. So today's topic is actually very relevant to, I guess, most or if not all of everyone here. Is on mental health in Singapore and what are the kind of challenges, the hope, and how can we all contribute better in this space. So without further ado, I would like to invite our speaker today, Miss Xinyi, who will take us through this topic. Over to you. Yeah.
Thank you so much for the introduction. Okay, hello everyone. I see here that we are actually a relatively intimate group size, so I hope everyone can just like engage with me as much as you can. Keep it a bit more lively since it's a Saturday afternoon. And I think just to remember that I want everybody to leave this session feeling like they've taken away something and that they have actually enjoyed themselves and they actually did something in the afternoon that is good for their own mental health. Right. So to start off before even with jumping into the topic today, I kind of just want everybody to know, like maybe in the chat, just share maybe one thing, either that something happy that happened to you this weekend or like just the past few days, or something that you're looking forward to in maybe either tonight or tomorrow. So if everybody could just do a little bit of like a gratitude practice and type in something that you're thankful for or something that you're excited about into the chat so that we can get started on a livelier note. Okay, then I'll be looking at the chat in a moment. Please help me along the way because I can't do this alone. So if anyone, yay! Okay, I see somebody saying that they're thankful that they volunteer. That's a fantastic way of spending your time to give back. Okay. Ooh, 10 hours of sleep is fantastic. Yay! Okay, getting to recharge, excited to learn about mental health. Just finished a game jam yesterday. Nice, nice. Thankful for loving children. Thank you so much for contributing and starting the whole conversation today on a positive note. I myself personally have spent like the whole night yapping away with my friends last night. And to me, that is a stark reminder of how each of us play a part. While we have, I think, the good intentions of contributing to the society, in terms of maybe providing better mental health to people around us, it always starts with us. And I'm thankful that you guys shared all the good things that happened to you guys. And congratulations, Rachel. You mentioned that you had a fun graduation yesterday. Yeah. Okay, so to get started, today's session, I know we kind of scheduled for 2:30 to 4 p.m., but actually the content that we have to share and that we have to talk about would probably take less than an hour. I will dive into a bit more details because I know those who are actually signing up for this session, they may be a bit more interested in really understanding like what's going on. I know there's a lot of conversations going on. There's always news article coming out. There's always movement from the government and from all the different agencies. So as someone who is also still figuring out in the industry, I will share whatever that I know. And if you guys have any questions, any ideas, any thoughts, we then can have a discussion at the very end. Right. So to keep the conversation like two ways and lively. Okay, to kick it off, today's topic will be on like mental health in Singapore, like what are the challenges, what's the hope, what are our plans, and also for individually each and every one of us, how can we actually contribute, be it in small way, big ways to ourselves, to people around us, right? Okay, so let's get started. Okay, so as a starting introduction, just so that everybody kind of know where I come from, what's my company. So basically, I'm from the team called Mindline.sg, and we are a team under the company name MOH Office for Healthcare Transformation. Right, so this office is actually a private company set up under MOH Holdings. Much similar to a lot of the other healthcare clusters and organizations in Singapore, like AIC. You have all your healthcare clusters like SingHealth, NUHS, NHG, all of these individual healthcare clusters, they are actually all under MOH Holdings. But of course, we are government funded, um, even though we're privately owned, right? So that's just to give a little bit more insight as to like how the healthcare system actually works. When we're talking about the government. Government, it's always the Ministry of Health, Transport, Education, etc. And these are the ministries, and they make the policies. For a lot of our companies like MOHT, then we are actually an office set up with a certain mission and vision in mind. Right. So specifically for MOHT, it's actually an innovation unit set up back in 2018. The whole idea of it is to actually lead and facilitate a lot of like system level changes. Right. So it's looking at using technology to transform healthcare delivery. And we do so in a few ways, right? So we run experiments, design, and then we test out the solutions that we have ideated with the different agencies in mind to look at how can we address some of the health system priorities. And we are looking at always at addressing it at scale. So this is one way that we're looking to optimize a lot of our healthcare systems and processes currently. And then the second big component for what we do is actually a lot of collaboration and partnerships. We look at enabling different partners across the entire healthcare system to implement and also scale a lot of the solutions that we are actually ideating. And the heart of all of this is actually with technology. So in specifically to like mental health space, because we are actually an innovation unit and it's heavily dependent on technology, where our forte is, where we contribute the most is really in the digital mental health space, right? So for MOHT projects in particular, there are a few ongoing ones within the team. The ones that I've highlighted on the screen here, like the National Mental Health Hotline and Text Line, Mindline.sg, and the first stop touch point. These are the few things that are actually already running and in place, and I'll dive a bit deeper into them. Hope is also in place, but that one is a bit more tier 4 intervention level kind of work, right? And then of course you have your we are in the progress of building up ICBT tool to support like work for mental health care within Healthier SG initiative. And then we are also building like digital mental health connect algorithm to help better identify and also then be able to direct people to the right care that they need. So a lot of these are actually in the works in the background, but I'll dive more into the things that are actually already live and active in our space. Right. So specifically for Mindline.sg, that's where the team really comes from. So grandfather story, we actually started back in 2020 at the height of COVID. So I think at the point in time, everybody was feeling very anxious, dealing with a lot of isolation issues. We're feeling very confined in our own spaces. Maybe close proximity with family also brought about quite a few challenges within families. Separation from maybe our friends, our loved ones. All this caused a lot of anxiety globally, right? And then that's when within MOHT, a few of our leaders actually put together Mindline.sg, which essentially is a self-care resource platform at the very beginning, providing some basic information to share with Singaporeans or like anyone in Singapore, what are some of the resources available for them, what are some of the ways that they can do self-care. And then it grew from there. So Mindline.sg as a project really born out of need when mental health concerns were rising at the height of COVID. And then progressively over the years, what we did was we then start implementing different kind of resources available. For example, working with certain organizations like Wiser, who has an AI chatbot based on the logic-based AI. And they have a full suite of different kind of cognitive behavioral therapy based exercises that can be delivered to individuals through the modality of an AI chatbot. And then through that, we then make it even more accessible for everyone to gain access to self-care resources. And then over the years, we then develop different content, curated resources, personalized resources for different for different population. There is the one for the working population, which is called Mindline Network. There is also Youth Mindline, which we co-created with a bunch of youths to really listen to what the youth's concerns are, what are some concerns that is unique to the youth population. And we curate resources for that, and we came up with a version specifically for the youth population. And we work with a lot of different organizations within the healthcare system, of course, to look at delivering these solutions, to look at supporting either their employees or their community members. And then we have gained enough traction over the years, such that at a point where the National Mental Health Strategy was then launched, we were then appointed as one of the first stops for mental health in Singapore. So I will dive more into that as well. So just kind of like keep some of this information in your head as I go along, right? This year, we actually launched National Mindline 1771, which is part of the first stop for mental health in Singapore as well. And all of this then started coming together. And I guess like this story paints the picture that a lot of the work that has been done through the years didn't appear at a flick of a finger. It really happens like with little try and errors along the way. Small projects come up, it gain traction, we see that there is a gap, we come up with solutions and we meet those needs along the way, and we do it in very quick and fast manner. At the same time, yet it's validated. So that's really where the strength of MOHT is, and of course with the entire whole of government efforts. And there's a lot of other organizations in play. But this is what Mindline has evolved over the years. And right now, we are at a place where we are providing national resource like on the nation level, right? So I guess like to set a context, after all the introduction of both like MOHD and Mindline, to set a context, I don't think it's something strange for anybody to really know like what are the current state of our mental health concerns within Singapore. Yes, we talked about a lot. I put out just like two easy to look infographics so everybody can just roughly take a look. It came from like National Population Health Survey back in 2022, and also like the Ipsos World Mental Health Day in 2023. So some of these report statistics, they really put it very nicely in graphics. The credits is to today. And then I guess some of the key concerns that as we look through these numbers, a lot of the times I think the numbers for me, it flies over my head. But when I really look at these numbers, some of the things that really stood out to me is like 17% of us actually face mental health issues. And even at this number, when I look at people around me, it basically means 1 in 5 people are struggling at some point in time. And yet, when I relate it back to my own life, so this is for everyone's interpretation, right? But when I relate to my own life, I feel like probably this is underreported. There are probably a lot of cases of people dealing and struggling with life stresses, but they not necessarily deem themselves as having mental health issues. And that's how I relate to the numbers that are being reported, right? And then let's say if you look at the extreme end where there's 27% of them who actually considered hurting themselves or taking their own lives, it is 27% who has ever thought of it once or more than once. And that's almost 1 in 3 people in a lifetime who has ever had those thoughts. And I feel like that number is pretty stark. And and to me, in my own life, it doesn't feel as close. Like people around me, yeah, I don't think every 1 in 3, but I guess like statistically, like that is the reality. And I think all of these numbers really put into place. And for me, it helps me realize like how stuck it is. And I don't know whether or not are you guys in tune with this, but I just thought to flesh it out so that you guys can all take a look at the numbers and like refer to it in the future. You can also search it online. But the whole idea is that there is a rising concern for mental health related concerns, right? So naturally, I feel like mental health has been a national focus for a while it seems like only recently it really is up and coming. Like in preparation of this, and of course, like through my years in MOHG, I then come to realize that actually back in 2007, it has already been set in place. There are certain things that has been ongoing in the works. And I think that is really the amazing part about like Singapore government and Singapore like how things are run, because it can go way back and these things take time. And it's never too late to start. And the whole idea is we want to start as soon as we can. So the first blueprint actually came out in 07 to 12. And then subsequently there is the community mental health master plan. And then now I think the most relevant content for anyone to make reference to is to actually read up on the National Mental Health and Wellbeing Strategy. So you can easily search online for it. There is a nice report with beautiful graphics for you guys to read, and there's a lot more information and content. But I put out a few things that I think stood out to myself. I think one is with understanding first the different factors that actually even affect individuals' mental health. And I believe a lot of us who study psych, who study like let's say social work, whichever relevant field of studies in this area, this wouldn't be unfamiliar to you. But let's just go through this together lah. So I think for individuals, it always starts as individuals, right? Our self-esteem, emotional skills, coping skills, our social skills, all of these play a part into how well our mental health is. And then we have like the next social circle influencers, which is our family for immediate support, and also a lot of your childhood development is formed with family, right? And then you start going to school, and that's when you form your social relations, interpersonal relationships, and your support system in schools also play a very big part in how well you're supported for your mental health. You have your workplace. Once you enter into your workplace, that is also a big component of your life. You spend one third of your life at your workplace. So then that's where workplace health is very important. Well-being in workplace is very important. Having psychological safety at work is also a very key component in individual's mental health state. Then you have your immediate environment, your neighborhood, your interest group friends, your CCA friends, etc. And then at the very end of it, of course, you have then your services in the community to really support a lot of the mental health that we're dealing with. So you have your family service center, you have your community mental health teams in the community, your GP polyclinics, all your health systems actually really come into play to support mental health. And then, of course, when you look at the macro system, then there is the overall cultural aspect to what people think of mental health and how people perceive mental health, which will then have a very big impact on our mental health as well. So as part of that whole national strategy for mental health wellbeing, it actually covers all the different areas from building up capacity for individuals, enforcing our environmental supporting systems, and also building like having a lot of different awareness campaign nationwide will really help to develop and strengthen all of these elements and factors that affect individuals' mental health and to build up. So all of these are actually in play in different aspects and angles, right? As part of the National Mental Health Wellbeing Strategy, there is actually 4 key areas just to highlight it here. Of course, you guys can read it in detail, but this really highlights like the key areas of concerns. Number one, of course, we want to look at focusing on youth, and to me, that makes a lot of sense because I feel like a lot of my friends, so speaking on a personal level, a lot of my friends do face a lot of challenges with overcoming certain challenges in their childhood or certain trauma that they are still processing, or there's certain grievances that they have not yet overcome, and including myself personally as well. So I think in starting from the youth population, in re-enhancing like how we provide support in schools, that is actually a very key component, and MOE is also stepping up in doing a lot of those work. Of course, in additional to that, then there is also increased community mental health teams. So then there are certain information and infographic that will go outdated over time. And this is like one example of it, and things move rather quickly. So this was actually available just I think last year, no more than 2 years ago. But right now, actually, like the community outreach teams and community intervention teams are gonna be renamed as the community mental health teams. So then that would be the standardized term moving forward. Of course, they will have news afterwards just to share with you guys that these are some of the things that are moving along the way. And then these services are provided under AIC. So it's the Agency of Integrated Care. And they are the ones overseeing a lot of these services, these teams in the community that really runs the counseling services, psychotherapy services, etc. Right. Then you have the next one, which is actually to provide the tiered care model. And this comes along with many different layers for before implementation is possible. Right. You first need to come up with the definition of what each of the tiering is. So you have on the right side of the screen showing you tier 1 to tier 4, what it means, what's the goal of it, what are some examples of the resources that can be provided. I wouldn't dive too much into it, but I think in understanding the tier 1 to tier 4, it really did help frame a lot of the interventions that is being implemented subsequently as you see it coming along the years as part of the national strategy. Tier 1 is a lot about promotion, which I think targets the cultural aspect. You have a lot of awareness campaign, wellness campaign, be it from WSH Council, or you have Beyond the Label Festival, you have a lot of like it's okay to not be okay. You have your Real Space campaign by AIC. A lot of these different campaigns really go out there. So I don't know if you guys see in MRTs, but you will see like there's a lot of this kind of like campaigns going on where they plaster it everywhere to tell everybody that it's actually okay to support one another. Or the HPB has their own campaign previously also teaching individuals how to support one another. What are the different kind of supporting styles? So all of these are really looking at enhancing all of our own individual awareness and also building up the whole culture of everyone supporting one another. So then these efforts are mainly tier one focused, right? Then of course being tier two and three, then you have different level of resources available. And that's where also Mindline then comes in to support some of these digital resources as well. Then you have tier four, which is mostly held by IMH, where they come up with actually like professional services. You're looking at your psychiatry help, your intense, more severe cases therapy. You're also looking at maybe crisis intervention and crisis support, let's say by SOS or by IMH emergency hotline, etc. So then these are some of the resources looking at targeted to service those who are maybe in urgent state of crisis, requiring immediate intervention. So then this allows us to really look at how do we develop solutions that fit to each level of needs. So that's something that came out from the national strategy. Then you have the component where you want to expand your healthcare capacity. So looking at increasing capacity in IMH and public hospitals. We want to train more frontline volunteers. We want to build up more community mental health teams. So previously, I think it was less than 100 teams island-wide. Now we are looking at about more. I think they are looking to expand to 140 and more by in about 2 to 3 years' time. So all of these works are really like being doubled down on to ensure that we have enough capacity to continue supporting individuals in Singapore. And to extend, the fourth one is then to extend mental health services into the community. So I think we used to think that for mental health support, you need to have, you need to seek specifically, let's say, looking for counseling clinic. You need to go to specific places to seek help. But what they are looking to do is to make it even more accessible in the long run, where you have you are able to go to GP polyclinics, maybe raise your concerns, and then have them be able to direct you to the appropriate need level of support that you actually require. And then increasing the capacity for even like GPs or your community service providers to also have the capacity to deal with mental health related concerns. And this then cuts down a lot of wait time, cuts down a lot of people bouncing around in the system before they get the help that they need. And this then paints up the picture of how the national strategy aimed to implement to increase accessibility, to make it easier for people to seek support. Okay, so just now I mentioned something about the first stop for mental health, the first stop touch point, and what that is essentially is a no wrong door concept, right? As part of the national strategy, what we want to do is to implement first stop touch points. The whole idea is that there is different avenues for people to seek help, and we want to establish it through an interconnected system for people to then get help that they need, or even take the first step of trying to seek help. So I'm not sure how many of you feel this way, but last time when I think about it, the only way to seek help is to call SOS. And then like that's the only avenue that we were all familiar with, or that my friends were all familiar with, or the community that I'm interacting with were familiar with. And anything else didn't seem to make sense or didn't seem specifically targeted for mental health. And what we want to do is to try to close the gap on that, to make it even more accessible and easier for people to take the action of or taking the first step of seeking help, right? And in doing so, we then need to provide and cater to different types of individuals out there with different comfort level in terms of the kind of contact that they prefer. So this is where the three first stop touch points come about. And the whole idea is that you just need to remember three words, right? Click, call, visit. So for the click one, you click into a website here. So click, call, visit is the later campaign that will be rolling out. You will see like national campaigns moving out, rolling out nationwide in the coming months. And it's the easier way to remember. But essentially what it means is that you have the digital aspect of seeking help, which is a website on Mindline.sg that you can then find self-help resources. You can find digital tools to help you support your own mental health and self-care needs. And you can then be connected with the rest of the systems. So that's one. But not everybody is digital savvy. Not everybody likes going on the internet to search for information. Some people want it to be a bit faster, a bit quicker, or they just want to talk to someone immediately. That's where the National Mental Health helpline and text line really comes about, and it's called the Mindline 1771. So with that, it's a 24/7 counseling hotline where the hotline is actually manned by counselors 24/7, and anyone can call in. The service is available for anyone from cradle to grave. When you call in, you will then be spoken with with a counselor. They'll walk through some of the concerns you have, understand what's your needs, and then best suit to find the next best suited support that you actually need on a more long-term continuous basis. But at any point in time, if you do wish to call a hotline, they will then support you accordingly. So then this makes it way easier for people to gain support, not just calling SOS in crisis times, but in cases where we are feeling like you don't know what to do, or you don't know what you're feeling, or you don't know how you can cope with certain struggles that you're dealing with, then the 1771 is an easy way for you to reach out, right? And then you have the last one, which is in person. So I think some people don't want call, don't want go online, then that's where the visiting in person really then is another avenue. Maybe for the elder generations, they're not too comfortable with either like their phones, and they wish to walk in person. Then we have the community mental health teams lah. Right. So then this is the in-person first stop touch point by AIC. And then this makes up what we like to call a world-class like mental health ecosystem, and that's our goal, that's our vision. What we want to do is to create this integrated first stop touch point across all the different types of services, be it through online, through in-person, or through text, that can really like support anyone in Singapore to find the right solution for their mental health needs. So if you see from this diagram here, it looks a bit convoluted, but that's the whole point. For people to come in and know like there are different ways that they can go about to get to the point that they need, and it really depends on where they're coming in from, and everybody's journey may look a bit different. So for someone seeking help, they can go to any of these touch points that they prefer, and then from there they may understand what are their needs and then actually head on to the next best system that fits them. And in any case, if there are individuals who are already in the system for human-based services, they can then be supported through their journey with self-help resources through digital platforms that we are providing on Mindline. And then along the way, of course, we are always looking at innovation on how we can better understand the needs of the people calling in, better understand the kind of concerns that people may have, and all these requires a lot of work in the background. We have data teams on this, we have psychologists looking at the data, we have teams maintaining a lot of these systems to really make sure that we keep on top of all the information that we're gathering, and to also be able to understand what are the future needs possible. Right. And the whole idea of a lot of these digital resources that Mindline is creating, a lot of the digital tools that we are implementing, it's always complementary to the in-person services, and we cannot do away with having like counselors, our psychologists, hospitals. All of these are essential, and community service, all of these are essential. And where digital really comes in is to fill the gap, to catch people in between sessions. Let's say when they are in between appointments that are months apart, that they would always have some tool and resource to support them through those waiting time in between, to better catch people along the way. And that forms up the entire ecosystem that we envision it to be. Right. So specifically for the human-based services, to kind of like point out what are some of the providers or services in play, or like the agencies in play, for the community mental health providers, that one I've mentioned is the community mental health team under AIC. Primary care providers are like your GPs, general practitioners. So then there is a pool of them who are who has the capacity and capability to manage mental health related concerns from their patients. And then you have also their polyclinics who are also upskilled to do that. Family Service Center who focus a lot on like family related concerns, but they also provide counseling, family therapy. You have your crisis support providers, which is like your SOS. You have a few hotlines in the community still, where there are options for people. So let's say if so some of the organizations that we know of are Children's Society, who provides their own text chat channel for youths, especially like those maybe like still in primary school. We have those. You also have like private organizations who are also doing that work. For example, Youth Line. And there are a few more examples in the space like that, right? But for support specifically, it would still be SOS and IMH. And of course, your emergency services like 995. Then of course we have our community forum, which is also a product under Mindline.sg. I'll share more about that in a bit. And from time to time, I think there's a lot of comorbidity with like mental health related concerns. So then you have also other organizations supporting specific concerns that may arises. For example, like NAMS, that looks at targeted at like gambling and addictions related support. And you have a few of these niche area with different organizations supporting as well. So then this really makes up like the entire uh ecosystem. Yeah. So at this point in time, maybe I'll take a pause because I've shared a lot of context. Does anybody have any question at this point in time before I move forward? Yeah. So if there is no questions, um, could y'all give me a thumbs up, like a reaction? I think there's the reaction button, right? Yay! Okay, I see the thumbs up coming up. Okay, awesome. That means I'm not losing you guys. I still see I see the thumbs up moving about. Yay, fantastic. Okay. So I know at this point in time I have been like blabbering on and on. But I think this really sets the context of all the things, all the moving pieces in the community to really support mental health in Singapore. And we will see a lot more of those coming up. There's a lot more community effort, and a lot of them are not necessarily branded as mental health support or resources, but it all comes with that layer of care. And then they may look at supporting different aspects, different factors that play a part in our individual mental health, and that all contributes. So there's really, really many different ways that we can contribute to a better mental health in Singapore. And we all got a part to play in each of this area and aspect, which is the whole point of today's conversation. We want to know how can we contribute, right? And like this then kind of shares with you all the different and possible avenues for each one of us to look at where do we want to park ourselves, where do we want to like put ourselves into to really like see where we want to contribute. Yeah. Okay, I see that Kai Ting has a question. Is there some kind of continuity between the different touch points? So I will be showing what my lines actually look like. I'll do a live demo. So when you look at that, you will see how it actually connects with some of the other services. And there is that continuity. And some other examples of continuity between these services would be, let's say for the National Mindline 1771, it is actually, the counselors are actually a team under IMH. So then this allows them to be able to gain professional oversight with a hospital, so there's clinical oversight on the work that they do, and then when required, they can then bring in their emergency team to support the resources. We also look at establishing connections between other organizations doing the work. So for the National Mindline 1771, they also then do a warm handshake for callers between themselves and SOS, in any case when SOS do really need to come in to support some of the cases. And I guess these are some of the examples. When I show Mindline.sg, you kind of see like how all of these are actually interacting with one another, and it leads to the different touch point. Yeah, so they are connected in short. Yeah. Okay. Okay, so then now I want to kind of dive more into like Mindline.sg, because that is our bread and butter, and that is what we are most proud of. The whole idea of having this national digital platform really is to be that one source of place where people can go online, where it's accessible anytime, anywhere, and it's available for individuals at a click of a button. You can visit a URL, you can access all of this information, it's free of charge. You get connected with all the different services in the community. And in hearing all of this, if it's not for yourself, then maybe for people around you, if you ever come across someone who may need some of these resources, then each of us actually really have a part to play to show, and we really count on individuals like yourself to then share it with people around you, to let people know like there are options available. Um, and I'll go down the whole path for each of it, but I'll kind of just highlight. I think there is like, in my mind, there is 5 key features on Mindline.sg that anybody can use, and there's different use case for when each of these features become relevant in your lives. The first one is of course the self-assessment tool. So I think for many of us, we did learn, there are different like screening tests and tools and whatnot. Specifically for the self-assessment tool is actually based off PHQ-9 and GAD-7. So then this is a test that people can easily answer a few questions, and then they can uh get curated resources on Mindline.sg. So I'll bring you guys through the journey in a bit. The next one is self-care resources. So depending on the kind of mood, the kind of concerns that individuals may have, they can then find the right resources that fit their current need and current emotional state. And this all allows people to basically self-manage. Um, I'll share a bit more, but in the most useful element of this to me is like, I have one example that I always love to use because it makes so much sense to me. Is that I don't know if you have come across cases of people, like let's say if someone's hyperventilating or if someone is struggling with breathing, it's easy to tell that person, like the immediate, like anybody, like if I am hyperventilating, I know logically that I need to be slowing down my breathing. But the challenge is always whether or not what I know can I actually execute in the moment. And oftentimes that is the struggle with mental health related concerns, that we feel it, but we may not necessarily have the capacity to execute what we know would help in those situations in that immediate moment when our capacity is low. And that's where all of these additional resources really comes in to help. So let's say if you have a breathing exercise, you have someone external, not someone, something external to help guide you through knowing how to slowly breathe, knowing how to breathe slowly, knowing how to take your pauses and take your breath, how to do certain reflection, how to have certain guiding questions, in the middle of the night, 2 a.m., where you have nobody else, then these are the resources that can really rely and make a difference in those moments of needs. And that's where digital resources really come in to fill that kind of a gap. And that's where self-care resources really stands and shine the light on these kind of situations the most for me. Right. Then of course, apart from that, we all need community support. So that's where we have Let's Talk by Mindline, which is an online anonymous forum. And on that forum, what we can do is different people can ask questions and they can get supported by professional like counselors and therapists on the platform, as well as our group of peer supporters and befrienders who are volunteers on the platform. But they all have an intention to help, and they have an intention to share their stories and to support one another through life's challenges. And that's where the power of community really comes into play. You see how different people share different content, different stories. And the most important and most powerful thing, I think, is knowing that you're not alone in a certain problem. And that's what we want to leverage on. That's what we want to build upon. Where we have people sharing their stories and people reading each other's stories and knowing that they actually have support and they are not alone, and that there is alternatives for them to consider, um, no matter the challenges that they are experiencing, right? And that's where Let's Talk come into the picture. So in any case, if all of these doesn't support you well enough and you really need more intervention type support, that's when Mindline 1771 comes into the picture. You get to talk to a counselor, talk to a professional on the line 24/7 available. And in any case, when people are ready, then they can use the service wayfinding tool to find which are the best in-person support that they can find in their community. by vicinity or by the types of support that they need. So I'll run through each of this on Mindline.sg. I love doing that because I think it's really interesting. So let me just pull up the live platform so everybody can take a look together. Okay. Okay, so what you're seeing on the screen right now is Mindline.sg. So if there is anything that you take away today, you just need to know like Mindline.sg. Mindline.sg is the digital first stop for mental health in Singapore. Okay, and then on here, everybody's experience can be a little bit different, depending on which kind of content that they like. But when they land here, there's a few things that you can do. You can read on to what are the different kind of resources that is actually available, and what the first stop touch points are. They can go in specifically to each of these versions of Mindline for the curated resources. But you can also click on I'm new here. The entire design principle for Mindline.sg is anonymous. We are aware that most people are still maybe a bit cautious about revealing their identity, or they don't want to be associated with having need mental health support. And this perspective is changing, but in the midst of it changing, we still want to cater to those who have not yet been comfortable with having such concerns or dealing with such struggles. So that's where like anonymity is one of the key design principles when designing Mindline. So the whole experience is anonymous, but you still can come in and then put in certain things uh to make the whole experience personalized for yourself. Right. So you can give yourself a nickname. I put Red because my surname is Hong. So I just put Red. And then for my age group, 20s to 40s. Right. Once I come in here already, you'll see that there is certain personalization in place. There are certain concerns that we have curated specifically for this age group, which is very relevant for me. There's a lot of work-related stress. Like right now, I'm also doing work, and there is some level of stress along with that as well in wanting to make sure that I share the most relevant content with you guys. Um, like getting rest is essential to me as well, and all of these are curated resources that I can click in. If I don't want to think too much, I can click through and then do something that is actually good for my health and good for my mental health. And then through these, like I've mentioned just now, I think one of the concerns may be that we want to know what's our emotional state like. So that's where you have your assessment. I wouldn't go through the entire thing, but the whole idea is you can go through certain Q&A questions, and then at the last part of it, okay, maybe I'll just run through so you guys can see what it looks like. Okay. In any case, if there is a concern, then they may ask you to do more questions, right? And then at the very end of it, you'll get to a point where you may then be recommended resources that is dependent on your state. So these results that return is also it coincides with the tier 1 to tier 4. So in that case, the questions that I've entered in just now then do call for a more immediate support, and that's where we bring those resources immediately to these users in the most direct manner to ensure that they get the support that they need. Right. Otherwise, I can also go into different elements in the platform and seek the help that I need. So the mental health assessment is one. Other than that, we also do have other resources available. For example, you have your AI chatbot, where you can get a whole list of different resources. But on Mindline itself, let's say if you were to go for the youth population specifically, you will see that there is content specifically for the different seasons of life. And all of these are curated resources, specifically with articles, videos, self-care exercises, learning paths, and different kind of practices that you can do. There are videos to watch as well for you to then learn how to cope with your skills. And all of these are really to look at building up our resilience and equipping us with tools that can support our own mental health well-being. Of course, then you have Let's Talk, which I will show in a moment, but it's a community space. right? And then in the moments where you actually do want to find in-person support, you can do so. So this is an example of how the different touch points intersect and connects. Because from here, this is actually a tool that we developed with AIC to really make it more accessible and personalized for individuals to find a appropriate community support that fits their needs. So there's a few different types of services that is provided by the community mental health teams. And then when you click through, you can then answer a few questions and then get to a map view of the relevant providers that is in the community for you. Right. So if you look through all of these, you can also see in map view, so you can kind of see in your community which are the services available. And this makes it very accessible for people to seek help. If I were to click into any one of it, I can also go through the call or make an appointment or email them or contact them. And the whole idea is to make it easy, right, for individuals to seek help. So this is one. And then let's say if you, and then 177 is another example of it is 1771. It's always available on the bottom right of Mindline.sg. So let's say if you have it on your phone available, if you forget, you want a quick touch point through and get connected with 1771, you can then click here to access, like you'll be redirected to WhatsApp to start a chat, or you can call the number 1771 and get supported. So all of these are there are different touch points and like call to actions that redirects to the different resources available that we have implemented. Yeah. And I guess okay, then at this point, let me jump back to the sharing, right? So that's what Mindline.sg look like. I didn't dive into all the different resources, so I'll leave that up to you guys to explore your own time. Like the articles to read, the kind of exercises that you can do through the AI chatbot, and the different videos and curated resources that we have developed. That's up for anyone to explore your own time. Okay, so continuing on from here, let's look at like what we have, which is Mindline.sg that I've shared, and where does Let's Talk come into the picture. So as you can see from Mindline.sg, from what I've shared, there is actually a lot of content and tools available. And you're getting access to like CBT exercises, you're getting access to all the various resources available across different mental health organizations and domains. There is signposting as well, so that you can guide people and inform people where they should go. All right. So there is that sweet balance between hand holding them, but also and also just giving them the information so that they have the freedom and um control to decide what are the next steps for them. And that's available on Mindline.sg. But in itself, it's a resource platform and there is no engagement, no interaction. We don't actually get to hear what the community is saying, what individuals are concerned with. And that's when Let's Talk really comes into the picture, where we can activate communities. There is a question and answer function with professionals. Anyone can start conversations with one another, and then we can do wellness challenges together. We can inform each other on all the up-to-date wellness events that's ongoing in the community. And in this space, we oftentimes see people ask questions or comment on certain things that they feel like they have nowhere else to talk about. I've often seen people posting and then saying that like their story, their problems, at the very end of it, they oftentimes end with them saying that they don't know what else to do. They have no one else to tell this to, and they're facing certain troubles, and they really need help. And then that's where the beauty of Let's Talk is. We provide a safe space for people to then use that as an alternative way to seek help. Right, I'll show a bit of example on what it actually looks like, what are some example of these threads, so you guys can actually see what it's about. Okay, but I guess along the thread of what and how we each can contribute, I think this is an example of it. So where this even came about in the first place was when 2 years ago we were working with a bunch of youths. So we call out and engage a bunch of youths to join us in curating a lot of these resources in coming up with this new idea. So we sat down, we brainstormed, then we did like design thinking workshops. There was a lot of conversation going on, really understanding what the needs of the youths are. And then I think where it came and born from was specifically like inspired by the SG exams Reddit subreddit thread. And then on this, there were a lot of like different people's concerns. You would imagine it's just about exams, but the reality is people are actually sharing a lot of like mental health related concerns in that space, even when it's not designed. So but then that comes a caveat. And when we look at things like that, we look at what are the gaps, we look at what are some of the concerns that we can then address and make it better. And that's where Let's Talk was born. And we realized that there is actually a need for online space where it's safe, moderated, and it is curated for mental health related concerns, where it's sensitive enough for people to share vulnerable sides of themselves and yet be met with care and concern and support rather than potentially facing risks of people who are not so kind, people who might be giving concerning advices, or people who might not be very like nice in general, as you may see when you come across like keyboard warriors on the internet. So we wanted to create this space online where it's safe for people to do that. And that was actually one of the biggest breakthrough of ourselves to actually come up with something that really speaks to the youth and giving space for people who maybe feel like there is no other alternatives out there. And Let's Talk is then that space for that. Right. So Let's Talk. The whole idea of it is what we want to do is we want to hold space for youth to seek help anonymously as an alternative way to do so in cases where you have certain thoughts that you are troubled with, you're concerned with, but you're not so comfortable sharing with people around you. Let's say your friends, your family, your teacher, your school, because you maybe feel like there's string attached or that you have certain things that you're processing but not yet ready to share with people around you. But yet, it's always helpful to get perspectives. And you can't get perspectives if you keep it all within yourself. So that's when Let's Talk really comes into play, where you can ask questions and receive support. You can engage in supportive conversations. You can learn about self-care tips, exchange experiences on certain self-care resources or certain coping skills, and be part of the community where it is safe and curated for mental health concerns. So some of the like a forum, some of the key features would be that you can connect with like-minded youths, you can interact with professionals. So we work with like counselors, therapists who have account on the platform and actually provide their professional insights. So these conversations don't qualify as counseling, but it is therapeutic conversations. There is a like the counselors will then share insights on what they think as a professional, how, and it gives people inklings and insights into how it may look like if someone were to seek professional help on a long-term basis. And what we want to do is, if there is a need, if you feel like there is value in that, we want to encourage people to do that. And in our beta testing phase, we have actually seen individuals who has commented that after trying this out, they realize or they did away with some of the previous assumptions that they had that was stopping them from seeking help, but now they are ready to do so. So what we want to do is really normalize such conversations in a way that speaks to them in a way within their comfort zone, and then to get people to seek help. And that's one way to do so. Right. Of course, we can also share resources. And at the end of it, the most important thing is to actually keep the platform safe. So then there is like content flagging functions as well. And like I was saying, the whole idea of it is we want to moderate and keep it safe. So this slightly technical, but we have a few ways of doing so. We have like filters in place. We have AI systems in place to kind of detect toxicity or spam. There's also a queue system where we kind of review questions being submitted to ensure that they are safe for the community and they are safe for the individuals posting before we make the post public. And then we always have human supervision on the platform on a daily basis. It's not 24/7, and we are not a crisis support platform, but we do have human eyes on it for most part of the day in Singapore time. And we are on the platform on a daily basis to provide the level of care and safety to every individual using the platform. Yeah. And that's through the platform. Like I mentioned just now, on just digital resources alone, we don't usually get as much insights on the concerns that people are facing. But on a platform where people are asking questions and sharing their concerns, we really then get to see what are the top concerns among youths and among users on Let's Talk. And I guess it is just interesting information, right? We actually do see that self-esteem and confidence really comes out as some of the top few concerns. that people are oftentimes feeling like they are not sure of themselves, they have self-doubts, they don't know whether or not what they're doing is what and what. And there's a lot of concerns on that. Then the rest of it, of course, like depression and stress comes up quite prominent, and interpersonal relationship and family. And we realize that these actually really are some of the top concerns, and these are also all interacting factors that I've shared in my first slide, right? That talks about what are the things that actually affect individuals' mental health, and it shines through even in the content and concerns that we see on Let's Talk. And we then look at how can we better support individuals. Yeah. So um I've shared in different ways what are some of the ways that we can contribute, and one of the ways that we hope to share with you guys is also in that we do have a volunteer program. It is our volunteer befrienders program, and the whole idea of this, right, is to build and empower a group of youths to create an online space and an online community where it's vibrant and supportive. And how to do so is through Let's Talk, where it's an anonymous space. The whole idea is for these individuals to come in, they will get some basic training, they'll get some basic guidance on the role that they play on Let's Talk, and then they can thereafter provide their listening ear, provide their perspectives, their encouragement to the individuals on the platform who may be sharing their concerns. And it's we wanted to keep these something very accessible for anyone to come in and support. You don't have to necessarily sign up as a volunteer to do that. Any user actually can go on to Let's Talk and play that role. But let's say if you want it to also support some of your own personal goals in your resume and building out your portfolio, we'll be happy to also work with you guys in setting up a volunteer relationship, right? Where we will then track the post that you are submitting. We will have some clinical oversight and supervision to the work that you're doing, and then we'll give you feedback to the experience or the kind of comments you have been giving, the kind of support you've been giving on that stock to the other individuals. And if need be, we can write testimonies, we can share with you guys like the hours that you guys have clocked that you can put on to that may fit into the other aspects of your life lah, if it's relevant. But otherwise, we actually encourage anybody to tap on their own altruism to come onto the platform and actually like just play a part in being that additional voice of comfort and support to strangers online. No strings attached. But I think that's where the magic of community support really comes into play. Yeah, so just to share some numbers, like we have about close to 50 volunteers who are like relatively active on a consistent basis. They have crafted over like close to over 2,000 replies on the platform and provided care to over like 500 unique users. So these are like 500 unique individuals. We don't know who they are in real life, but they have all received kindness and support from the depths of the internet that hopefully made a difference in their life. We don't always know. I guess that's where it's relevant to kind of share you with your examples of what it actually looks like on Let's Talk itself. So on Let's Talk, you will see that oftentimes what the conversation look like may be an individual. So this is all public conversations, right? Anybody can access Let's Talk and read through all the threads, but in order for you to engage in the platform, you then have to create an account. Similarly, it's anonymous. We need your email address to verify to ensure that we block out crawlers and spammers. But other than that, the experience of the platform is actually based on your username, so it's an anonymous experience. The only time we actually break confidentiality is quite consistent throughout all mental health services provided, is that if safety is of concern, then we would have to go to the back end and retrieve the email and then manage accordingly. But otherwise, it's an anonymous experience. Nobody will know who you are, so you are kept safe. So don't reveal information about yourself either. But like this is an example of someone actually dealing with a physical ailment that is troubling for themselves. And then you will see that our professional, who are all tagged as professional, will come in and then share some of their own thoughts and opinions on the next steps that they can do, give them some ideas on what is like causing them with certain, like how to better support or like manage their emotions in the current moment, I think you see all of the responses underneath are actually from like volunteers and befrienders and the community to support this individual. They're giving different types of advice also. And you see that sometimes it's not always the case. Maybe out of 10 times, we see 2 or 3 times that the users actually come back with such gratitude, so shown so clearly about when we do receive that we are reminded of the work that we do and why we do what we do. So of course, it is just one way of seeing it. I think we also see it reflected in our own lives. When you help someone, they don't necessarily show you immense gratitude, but they do when they do, and when you know that you made a difference, it is always reassuring. It is always what feeds and encourages us to continue doing what we do. Right, so then these are examples of an individual who then have back and forth conversations and how we can support, how we have supported this individual through the different thoughts that they have regarding their concern. And similarly, for this one as well, there is like a lot of like conversations ongoing. So I'll leave it to you guys. I'll share a few links later in the chat, where you guys can either sign up as a volunteer, um, or that you can actually just use that link and sign up an account on Let's Talk, and just just explore it at your own time. Use it as a resource for yourself, share it with people around you. Up to you. Right. But that's what it looks like on the platform. Yeah. So going back to the slide. Yeah, so I guess I'm closing into the end of whatever that I have to share. I yapped a lot. Um, but I guess to end it off, this is like some of the examples that we have put out of like individuals. Maybe they just share. It can be a really short sharing. It can be just saying that they feel really tired after school, and they don't feel recharged. And different people really can come in to share their experiences to make someone feel like they're not alone. Um, and that like there are ways and alternatives and coping mechanisms that we can all take on to take better care of our mental health, and we can contribute in small ways. Uh, so we can contribute on a platform like that, can contribute in our own lives, building up our own capacity, strengthening our own mental health, so that we can then be there for other people. We can show up for people around us, be it in school, in your own family, or whatever awareness that we have regarding our own resilience, our own mental health. We then share it and propagate that in our own circles of influence. And of course, let's say for each one of us who are studying a related field, then hopefully what I've shared regarding the context of like mental health strategy and plans in Singapore, you would see yourself being parked into any part of the whole big puzzle, either providing frontline care, providing back-end care, providing your brain juice in innovation work, or that you want to do more awareness related work, you want to do policy work. There's a lot of options out there for anyone to consider. And it all then contributes and play a part into building towards a better, more well taken care of mental health for the entire of Singapore and for each individual, each and every one of us. Yeah. So if you want to join us, you can just scan the QR code here to join us as a volunteer befriender, and then I'll follow up with you separately through the application process. And then I'll also share a link into the chat if you want to just sign up on Let's Talk yourself. You can also do so. You don't necessarily have to be a volunteer with us to be on Let's Talk and support others. So, I mean, from what I've shared today, the things that I think immediately actionable would be to engage on Let's Talk, to contribute to that community online, for support of one another. But other than that, I hope whatever I've shared has been useful, and that each and every one of us go on to contribute and make a bigger difference in the mental health space in Singapore. Yeah, and then that's all from my side here. Any questions from anyone?
Yeah, thanks, Xinyi. I think it's very informative. Anyone who has questions, please feel free to unmute and speak up. Or if you are not comfortable or not convenient, please feel free to type in the chat window. I thought, Xinyi, you did highlight a lot of important things, the latest developments, in the mental health space in Singapore, at the ecosystem level, right? As well as in the capacity, of Mindline, and MOHT, what are the latest developments? And I think the second half was very important to let the audience know what resources are available out there for actually people to use themselves, or even for all of us here to share amongst our peers and friends. I thought that is very useful for everyone here today. Yeah. All right. And also, yeah, so to draw everyone's attention to the chat window on the various links that Xinyi has provided, whether it's to sign up as a volunteer befriender. I thought that's something, if all of you are interested in, feel free to do so. Or even for yeah, let's talk, right? So I think Cindy did bring everyone through, some of the features, right, of what's available there on that platform. Okay. All right. So I think not many any questions for now. But I think feel free to approach any of us, from SG Psych staff if you have any afterthoughts after today. Feel free to share them with us, and we will definitely get close a loop with you, and we will, if need be, get in touch with Xinyi if there are any follow-up questions, especially pertaining to Mindline.sg, or any of the other yeah, features that of the platform that she shared earlier today. Okay. Now at this juncture, maybe if I can invite everyone to, it's a usual thing for our webinars, right? To, if it's convenient for you to do so, you can just turn on your camera for a quick, maybe 15-20 seconds. It's really for us to take a quick photo. It's a photo opportunity to commemorate today's uh, webinar in conjunction with World Mental Health Day yesterday, and in collaboration with Mindline.sg. Yeah, so just for a quick 15-20 seconds, if it's convenient for you to do so, I'll just give everyone a few more seconds to decide whether or not to turn on the cameras, and then after that, take a quick, I will count down before, or I'll take the quick screenshot, right? All right, so any last call, anyone else who's available to turn on your cameras? Okay, so at this juncture, I think I will take the photo. All right, I'm gonna count 3, 2, 1, right? 3, 2, 1. Great. Okay, so I got that all sorted.
Muted yourself.
Oh, sorry. Yes. Sorry. So at this juncture, I also wanted to take the opportunity to share, um if you have not already seen our socials, SG Psych Staff is currently opening our mentorship program for 2026, right? And I've already posted the link in the chat window. Feel free to have a look. It will basically it's quite self-explanatory. It will guide you to the our web page, where there is a link for you to decide, if you choose to join us as a mentee for 2026. So feel free to explore that link as well. All right. So at this juncture, okay, yeah, I see. It's Sydney. Thanks for dropping your number there as well, your contact. I think yes. So the discussions and discourse doesn't stop today. I thought it's very important to stay connected, especially in this mental health space. And all of us here who are working really hard in this space and trying to make um, um, Singapore or even beyond that a much better place, right? If we look out for each other, show care, compassion, empathy for each other. I thought that's very important. So keep in touch. And yeah, if anything else from Xinyi or Karlin before we end off today's session?
All
Okay,
good.
Put the
all good.
link I put the link for the mentoring in the chat.
Yeah. Okay. Yeah. We got that as well. Yeah. So, once again for the mentoring program for SG Psych Staff 2026. If you have not already done so, do explore the link and consider the mentorship program if you would like to learn more from our mentors in the counseling, psychology, and social workspace. All right. So without further ado, I'll wrap up today's session. Thanks everyone for attending today, the webinar this Saturday afternoon. Enjoy the rest of your weekend, and yeah, stay tuned for more talks and webinars from SG Psych staff. All right. Take care.
Thank you. Have a good weekend.